This episode we will call RBF. Today's lesson, or what I heard of today a couple times, was patients trying to address an angry face, tired face, also known as resting bitch face. So resting bitch face, or RBF, is when somebody is a nice person, or not. I mean, they could be an asshole, but they look angry, sad, tired. And what you notice is that they just look tired while they're talking to you, or they look frowny, or they look angry. So there are three places that this comes from on most people, and you can identify it. If they say, I'm tired of people telling me always I'm tired, or I'm always sad, or things like that. So number one is just simple. It's the furrow. Mine's kind of Botox because I don't want any RBF. So it's your procerus muscle, which is this vertical muscle in the middle, which could have one or two bellies, and the corrugators, which can extend out here in one or two lines. If somebody's over-exaggerating that because of just their dynamic or stress or tension, it comes across as RBF, resting bitch face. So they're always angry. The other is ptosis, eyelid ptosis, blepharoptosis. It's hard for me to explain to patients what ptosis is, so I show them a picture. What it is, imagine you could always walk around like this where your eyes are open. That's the opposite of ptosis. You could be normal where you're seeing the entire iris, all of it, or you could be drowsy where you're only seeing half of the iris, or you're seeing, well, that would be severe, but you lose a couple millimeters of show on the iris, meaning the circle of the eye. That's called ptosis, P-T-O-S-I-S. I beg you not to pronounce the P. It's not there. It's ptosis. So that's blepharoptosis. And people look angry, sad, and tired. Also, like as they're driving later in the night, it tends to fall down a little bit more and more. With that, you'll see that other people talk to you as though they're tired. They start to get sleepy as they talk because you project onto them sleepiness. So that's an interesting form of projection. Projection, people think, is just emotional, where someone's stressed or angry and you project that onto somebody else and they feel your anger and your stress. That's called projection. But you can also have a physical projection. You look tired, someone else starts feeling tired. So they start yawning when they look at people with ptosis. The last is angular depression, or frowning. So your chelion, or the corner of the mouth, has an angular depression, pulls downwards over time. That happens for a large number of reasons, but that is a very common reason for RBF that gets worse over time. For this stuff up here, the easiest thing to do, which works on 90% of people, is neurotoxins. That's Botox, Dysport, Xeomin, Jeuveau, Meditox, you name it. You can use all those and you can inject them into here, and a large proportion of people, it'll get it softer fast enough that you don't need to do anything else. Some people have extra bulk there because they have really thick muscles. And then what you do is you inject it with a higher concentration and you have them come back 2 weeks later, inject it again, and now what it's going to do is atrophy it. When your muscles aren't working so well, they're not getting their normal signaling, they shrink, they atrophy. Just like an astronaut going into outer space, they come back with weaker muscles and bones and have to do physical therapy. That's what happens. So you can actually shrink that bulk of muscle and make that area flatter and make it look happier. Some people have indentations that are so deeply indented, even Botoxing them is not enough. And you can put filler in there if you want. Careful though, it's a very dangerous filler area. If you inject into the dermal area, into the dermis itself, you're pretty safe. If you go down into the subdermis, or where the muscle layer is, which is also right where the SMAS layer runs, you have these vessels that run across and you can blind someone. So you do have to be careful. Doesn't mean don't do it, just means be careful and do it with someone who's good. So that's how you treat that RBF. Let's say you do a brow lift. Brow lift, unless you go cut the muscles there, it doesn't get rid of that. You still have to do Botox. I do tell patients, don't go cut those muscles. You can disinsert the middle one. That'll weaken it. You'll be safe. Then let the other ones work, and then you can just do Botox. That's all. So then we get down to the ptosis. How do you treat ptosis? Classically, we treated ptosis with surgery called ptosis surgery. There's conjunctival muellerectomy, there's a bunch of other procedures, but the ptosis is fixed by going inside the eyelid, reducing the mucosa and the muscle, and closing it up. You can alternatively do it from outside as well, but that's less predictable and used in other situations. If you don't have time to do that, and you have all these events you're going to, and you just look tired like this and mean, like you're just staring people down all the time, and you want to look bright and happy, body, you can get an eye drop. The eye drop that they have now is called Upneeq, UPNEEQ, and that's the company that took oxymetazoline, which is the medication that's in Afrin, and they diluted it and put it in the eyes. And what we were worried with all these other drops that we used in the eyes before for when patients got ptosis after Botox is that the patient could have a refractory type of reaction where they actually get worse over time or have redness in the eye and rebound and that kind of stuff. You don't see that with Upneeq, so it's safe to use every day. I still tell patients really just use it for events and things like that, but Upneeq is pretty cool. So that gets rid of resting bitch face part number 2. Resting bitch face part number 3. That's the mouth. We have this kind of chelosis happening where the chelion goes down over time. And this happens, some patients naturally who are down talkers, meaning when they talk, they just do this and they get bands earlier in life and they get jowling earlier in life. So this part comes down, the modiolus gets stronger, and they smile and then they pull right back down like that. So those are down talkers. That is like a physical tick that people have, just like smiling. You can't get a smile off my face. If a photographer tells me to stop smiling, I'm like, okay, I can't stop because my muscle tone is always up in that direction. Alternatively, some people have muscle tone that goes in this direction, and they know this because they look bitchy in photos, so they start to compensate for it. And today I had the loveliest actress, and she's very pretty and very beautiful and young looking, but in photos and in video, she has to do that. She has to smile to release it. So that's one patient that it happens. And then you can Botox those patients or you can train them. Not you train them, but they have to train themselves. But it takes a long time to retrain your muscles. There are some people who have done it since childhood because their mom told them, darling, don't make that resting bitch face. They didn't say it like that, but they said, don't make that face. You're furrowing. Stop making that face. So they train them from an early age not to do it. And funny enough, when they grow up, they don't have those wrinkles. So you can actually retrain your body. It takes a long time though. It'll probably take about a year for you to retrain. So you're not a down talker when you talk and you do this and you kind of talk like that all the time. The other effect that it has is what I said is that people start to get, this is a different patient today. She had that and started to get droopy over time. And she's only like 30 something and very beautiful and has not a lot of drooping in the face at all, but contracts down, and with a little thinning of skin, you start to see droopiness around the side of the mouth. That happened on this patient because her teeth were prominent. So the jaw is prominent within the lips. And when that happens, your mouth doesn't close in a relaxed fashion, doesn't close very easily. And this causes strain in the face. And the strain can show itself as asymmetries when people pull one side versus the other, or it can show itself as peau d'orange, which is the pebbling of the chin, orange peel of the chin, or depressor hypercontracture where it pulls the mouth down. But it can also make your modiolus, which is the connection of all the muscles that are strong, and pull that down. So these patients come in at a young age and they look indented here and droopy here like they're jowling, and everybody's going to tell them to do this. Someone said do threads, do facelift, do this, do that, do a million things. Realistically, they just got to do Botox. You do Botox on this area, it relaxes it. And if you want to tighten the skin around it, I do Profound. You can do Morpheus. Later, if you wanted to touch with a dot of filler here and there, very, very small amount, you can. The risk with these patients is that somebody tries to fill them, does not look good, or they do threads, does nothing on these people. Threads might work for other stuff, does not work for these people. So long term, this patient didn't come in asking me for this. She's like a model, and she comes in and I just gave her my advice saying, if this bothers you and you're worried about facial aging and you realize you have this strain in the face, I can Botox you. It's a Band-Aid. I'm patching it, but realistically, you got to go see a couple of friends of mine. So I referred her to Dan Grauer, who's an orthodontic doctor, and then Robert Relly, who's an orthognathic. Orthodontic, they work with the bones in the teeth. Orthognathic, they work with the bones around the teeth. They can actually move the teeth forward and backwards. In this patient, if she were to take the whole jaw and move it back in, the rest of her face would calm down, it wouldn't be strained, and she would age better. Alternatively, let's say she doesn't do that. Over time, this will get more and more pulled, and there's no other way to prevent that, even if you're Botoxing it. When you Botox around the mouth, and I'm not saying Botox because Botox is the only thing. Botox is like Kleenex. You can use Dysport, Jeuveau, Xeomin, Meditox, all of them. They all work. When you do it around the mouth, you have to be very careful so you don't knock out the mouth function. So you have to remember, the reason these people are straining their mouths is because they're compensating. They're trying to close their mouths and they're stressing to do it because their lip is stuck up here, and when they relax, it stays up there. So her mouth is just open all the time like that. And when she wants to close her mouth, she has to do that. So she has to make this compensatory motion for the chin to move upwards. If you go Botox the shit out of it, they can't move. They can't do that anymore. I had the same type of conversation with the other patient who had the ptosis today. She was asking about forehead wrinkles. And I said, well, don't Botox your forehead wrinkles because you have ptosis. If you have ptosis and your eyes are like this and your eyebrows are always up and you Botox that, your eyebrows will drop and you no longer have the compensation of trying to keep your eyes open. So you have to look at the face and realize that sometimes you have the strain for a reason. The strain is happening because there's another problem. So it helps you identify the problem, but also you don't get rid of the compensation all the time. If you get rid of the compensation, they're going to have problems. So if you get rid of the compensation of someone doing this all the time on a ptotic eye, they're going to feel heavy all the time and get worse. If you ruin the compensation of this, they won't be able to close their mouths, meaning B's and P's are going to sound weak, their lip is going to be floppy, their smile is going to be all weird. Same with the upper lip. If you ever inject that too much, it's going to be too strong. So I like to go very weak around the mouth. I inject it and I say come back in 2 weeks and I'm going to inject it again. That makes it easier. Let's say you're a genius. No problem for a genius. A genius can go do all the fillers and the Botox at the same time, predicting what's going to happen. I'm not a genius. I can't do that. So what I do is I tell the patient, let me Botox you now, come back in 2 weeks and I will take a look, see if I need to Botox you stronger. And then I can add a dot of filler at that point, because all these indents that you have right now in the jowling, half of it's going to be gone by the time you come back in 2 weeks. So I don't even have to treat it. That's all. That is resting bitch face 101. Thank you all for watching and being part of our community. Please drop any questions you have or anything that you want us to review that you've been wondering about or are confused about in the world of cosmetic or plastic surgery.